The first case we're going to be talking about today is trigeminal neuralgia. It is caused by compression of the trigeminal nerve, and it causes sudden onset pain of the face. Now, as you can see from the diagram here, we have got all the trigeminal branches outlined. So in blue, we've got the mandibular branch. In orange, we have got the maxillary branch. And then in green, we have got the ophthalmic branch. So if I draw in red, one of the common causes of trigeminal neuralgia, as I said, is compression, and this compression can be caused by a blood vessel, which I will draw in red. So if you imagine a blood vessel pressing down here, so draw it there, blood vessel pressing down on the trigeminal nerve as it branches off, it's going to cause pain radiating out into the regions of the nerve it compresses and the branch. So the pain radiates out, and the pain can go into any of the branches or all of the branches, like so. So very, very sudden onset pain. It lasts from 2 seconds to up to 2 minutes. So it isn't very long lasting, but it does feel like an electric shock passing through your face. Now, rarely is this compression another underlying condition, such as a tumor or MS. Now, the pain can be triggered by just daily activities. So if you imagine any way that you move your face, such as talking, chewing, and swallowing, and many, many others. So this can also be activities that don't even involve moving your face, just vibrations from sitting in the car, walking. This can all trigger the pain caused by the compression. So now let's move on to how it's diagnosed and the treatment options for patients that suffer from trigeminal neuralgia. So I'll just draw in here the blood vessel that is compressing down on our trigeminal nerve. It's just in here. And this would cause the pain again to radiate out to ophthalmic, maxillary, and mandibular regions, depending on where the compression is. Now, a patient might initially visit a dentist, as the pain is located to the face, and they will rule out any dental problems, such as a cracked tooth or infection. They will also rule out a very common problem facing people today, which is migraines, because the pain can be something similar. And if you go and look in the variation section of the trigeminal nerve, there is studies that look into migraines being caused by variation in the zygomaticotemporal branch of the trigeminal nerve interacting with muscles. If a person goes to see their GP, or even after they've been to the dentist and they go see their GP, the GP will take magnetic resonant imaging pictures of the trigeminal nerve, and this will help visualize the blood vessels which are inside the skull. And it can also look for inflamed lining of the sinuses and whether there is any other type of compression going on. So for treatment of this, it comes about by identifying the triggers that cause the pain in the first place. This can be difficult as most of the triggers are daily activities such as chewing, talking, swallowing, walking, with the vibrations causing the pain. So that can be really difficult for patients unless the trigger is something very, very specific. Medication is usually prescribed to deal with the pain, such as anticonvulsant medication. This would stop the nerves firing in the first place that triggers the pain. The last point of call if medication doesn't work is surgery. Now the surgery takes many different forms, and the most important thing is to ensure that the patient's needs are met and they're well informed, because though the surgery can stop the pain, it could arise from complications and there could be more pain after the surgery. So surgery is a good option, but pros and cons must be considered and told to the patients. So that's it for trigeminal neuralgia. Go and check out the models to see and learn more about all the nerves we've covered in this video, and go and test yourself and see if you can remember them.